Hello, my name is Lavinia Bradley and I'm the Violence Prevention Program Manager for Homestead Air Reserve Base. Today we will talk about suicide prevention talking points for 2020. These talking points will satisfy your suicide prevention training for 2020. Before we get started, I would like to issue a disclaimer. We do recognize that there may be some who have either been directly or indirectly impacted by suicide. If you or someone else is struggling, please know that the Suicide Prevention Hotline is a resource. The number is 800-273-8255, and there are other resources available at Homestead Air Reserve Base and within the community. This suicide prevention topic, we just kind of want to do a quick rewind of some of the things that we have learned in past suicide prevention trainings. We remember learning about acute warning signs, early warning signs, acute warning signs. Also, last year we talked about the importance of risk factors, and risk factors are things that just increase the chance that someone may suicide. It does not mean that they will. It just means that if some of those things go unchecked, that there's a likelihood that it could lead to that. If we remember some of the risk factors as life events that happen, and they can be perceived as negative or positive to us, but to the individual it can be a stressor. So some of those things may be financial insecurity or issues with finances, relationship issues where there's divorce or separation or a dissolution of some sort. Friendships ending can count as relationship problems. There's other things such as previous attempts, as well as history of alcohol or substance abuse, and some things like isolation or feeling alone, which we know with the pandemic going on, many people are kind of alone in their space. We don't have the interaction that we've been having. Physical illness can be another risk factor. Dealing with that. Easy access to lethal means can be something, and an unwillingness to seek help because of the stigma attached to it. And that one is important because I think as a Air Force as a whole, we try to destigmatize asking for help. We have a ways to go, and sometimes it may be the way that, the background that we come from, we're not accustomed to asking for help. Just like there are risk factors, there are protective factors, and some of those are easy access to mental health or early access to mental health is a protective factor. Having support of loved ones or family friends, we'll talk a little bit more about that because that's in line with connection. Easy access to a variety of clinical interventions or support in that sense, not just medical, but mental health, as we spoke about. Also, skill building, problem solving, conflict resolution, and nonviolent ways of handling disputes is a good protective factor. The one we want to focus on today is connection. The importance of connection. Meaningful connections. It's a valuable tool when it comes to suicide prevention. One of the things that we remember is that we as airmen, we have to be active in reaching out both to others who may be in distress and to resources for themselves and ourselves. So we have to be able to recognize in others and in ourselves when we need help. And sometimes, because I've heard this before, it's like we don't know if somebody is struggling or not, but the best way to kind of help facilitate someone coming forward when they need help is to build those connections. Some of the things that we may see in people is distress. We all know that stress is a normal part of our lives, and there's eustress and distress. Eustress, and some of you may have heard of this, is considered moderate stress, but it's also considered positive. It moves you forward in a positive direction. That test that you have to study for that gives you stress, but you know that when you pass it, it offers unlimited choices in maybe your career. Think about the military test. The other one is distress. And so occasionally when the stressors become overwhelming, or those risk factors, those life events, when they become overwhelming, it's difficult for people to cope, and it can actually cause people to experience distress or anxiety. Some of the common signs of distress include mood changes such as depression or anxiety, irritability, agitation, or anger, difficulties with sleep, and that may be that the person is sleeping too much or too little, and withdrawing from friends, family, and others is another key sign. It's important to be able to identify distress in ourselves and others to prevent the negative effects of those things. Some examples of ways to cope when we have stressful situations, and some of you may do this already, is through exercise, mindfulness, meditation. Some of you may have participated in iRest in the past, and that's a form of guided meditation. Recognizing and expressing gratitude is another one. I remember seeing the service for the chaplains where they had a 3-2-1 exercise, and the 3 was name 3 things that you're grateful for, name 2 things that you're hopeful for, and then name 1 thing that you're excited about. And I found that to be something that stayed with me, and it's a positive way to start the day. Also, connecting with friends, family, and nature is another thing to help to manage stress. I'm a water person. I like the ocean. I like to be outdoors in nature. I like hiking. Those things are things that help me to maintain and to help deal with stress. Some of the other things that we can do if we recognize that something is going on with someone is if we notice that they have symptoms, or that they state that they're in a state of distress, they may feel overwhelmed. They may have thoughts of death or self-harm or suicide. In that situation, we remember ACE. It's important to ask someone directly, do you plan on harming yourself, or do you plan on suicide? It's important to be direct and ask those questions so that you know how we need to move forward, or how you need to move forward. And it's important to be comfortable in knowing these things to do before a situation presents itself. The next step would be to convey that you care to the person who is in distress, that you care for their well-being, that you listen to them. This can also be done by paraphrasing, clarifying, and asking, clarifying questions, having an attentive posture. Communicate empathy and listen to the person, to what they're saying and feeling. That really communicates that you care, and just being with them shows that you care as well. The other part of ACE is escort. So if a person has expressed the current thoughts of self-harm or suicide, you got to get them to professional help to prevent the suicide and demonstrate that you care. With that person, you empower them without overwhelming them in the process by letting them choose 2 to 4 appropriate resources. So some of the ones that you may be thinking of right now, the DPH, Chaplain, Military One Source, EAP, those are all resources that they can take advantage of. But if it's an emergency, you really want to get with DPH, local hospital, 911, just get them to safety. Most important is getting the person to the next level of care or resource. So you don't want to leave that person in distress alone, and be sure to follow up in the days and weeks after a connection to help is made. That's important, and it just really emphasizes the fact that you cared and that you still care about their well-being. The next thing that we can remember to do when it comes to suicide prevention is to go slow, and this one might be something new for many of you to hear. It's important to build time and space between an airman in distress and their access to lethal means, so including firearms and medications. Those things can reduce suicide attempts and death. So when you recognize airmen in distress and use ACE, remember also to go slow. And that acronym stands for safes, locks, or outside of the home storage for lethal means. So remember to go slow. Now I want to talk to you about the importance of promoting resilience within yourself, because that's another protective factor. We talked about gratitude, expressing gratitude, and on the handout sheet, this one's going to be uploaded, Air Force Connect, there's some reminders of some things that we can do to promote resilience. A lot of the time you may have heard about self-care and how important that is, but what exactly is self-care and resilience? Resilience is the intermediary between an action that happens and distress. If you remember it being in the middle, it's the buffer. And the more resilient we are, the more we bounce back from those life events that happen. So some ways to practice self-care for resilience is to prioritize our health routines. We talked about exercise, but exercise is part of that. Nutrition is part of it. Hydration, sleep, human companionship is part of our daily life. It's an important part of being resilient. Journaling and expressing gratitude is another way for self-care. Connecting with others, maintain digital connection at this time, but also after we end the pandemic. Digital connection, physical connections are important so that people can overcome the feeling of isolation. Video gatherings. Lately we've been using Zoom. On base we've used zoom.gov or zoom.gov to kind of help even with our meetings, with those interactions with people. Talk to family and children. Let family members, including children, know that it's important to talk about their feelings that they may be experiencing, especially with regards to stress and anxiety. And spend time with pets for you pet owners. Having a pet has actually been shown to have calming effects. When you pet them, it can help with your blood pressure, it can help bring your breathing down, and just help with overall anxiety. So in conclusion, I just want to emphasize the importance of building connections with people so that it makes people more comfortable to come forward when they need help. Remember the signs of distress that we want to recognize. And if somebody is in distress, make sure that you use ACE, Ask, Care, Escort. And also remember to go slow, safe locks, or outside storage. Thank you for your participation. Make sure that your unit training manager knows that you've completed this training so that you can get credit for it in ADLS. And thank you for your continued support of violence prevention and resiliency program efforts. Thank you and have a great day.